That'll help.
All
right,
yeah,
there you
I'm
go.
gonna edit out the first part anyway, because it's just a little background for y'all. So, talk to you a little bit about Tipa Snow's model that she uses for the progression of dementia, and she calls it GEMS. And I'll start with just a short video from Tipa. So if you don't know who Tipa Snow is, he'll introduce you a little bit to her. And I don't think I can't give you that philosophy better than the words coming from Tipa. So, and I forgot my clicker. Let me start that on the clicker.
Time to talk about progression. How does this disease change over time? Now, unfortunately, typically what people talk about is loss. Oh, it's worse, it's worse, it's worse. And it's going to get harder, and things are going to get worse. But if that's all you're thinking about, you're missing opportunities. It's not just about the loss. It's always about what do they have left. And so I took the scales that were out there and looked at them, and frankly, they're pretty depressing. They emphasize too much, what's going to happen next, and it's not a good thing. So what I decided is, let's stop talking about people as though they were less, and let's start looking at people as though they still have something. My job as a care partner is to figure out how to provide the right support and the right care so they can shine. Quit thinking about them as numbers. Is this a stage 1, 2, or 3, or a level 1, 2, 3, 4, 5, 6, 7? And instead, how about if we looked at, how are they precious? How are they unique? What do they have that I can still use to help them live life? Because life happens, and we're both gonna live it, so how's it gonna be? So I thought, how about gems? How about if we thought about people as precious and unique? There's not a single gem that I know of that people don't find attractive and interesting. And if I could get you to think about people as having something positive, something good, and I got you to see them that way and understand them that way, then you may be more interested in providing the right setting and the right care so they can shine. And so what I did is I took a scale that's out there, Aelc cognitive levels, cognitive disabilities. It's something used in occupational therapy. And I took that and I built off of that. And what we have are gems, 6 of them, 6 levels. Sapphires and diamonds and emeralds and ambers and rubies and pearls. All of those are amazing gems, but they're all different, they're all unique, they all have characteristics. Now, the way I organize this is sapphire. Notice how it's on the other hand. It's a little special. It's a brain that's true blue. It's a brain that's not experiencing the changes that come with.
So for whatever reason, the technology isn't my friend today. So anyway, Tipa talked a little bit about the different cognitive scales that have been used and frankly still are used in mainstream care when we're working with people living with dementia. One of the earliest ones was a really simple early, middle, late. And so in early, people were usually still functioning at home, doing okay, but starting to notice something's not quite right. Middle, there's obvious changes that are occurring cognitively, and a lot of times that's when people would be prompted that they need more care, either at home or then looking for placement in a facility. Late then is the end stages of the disease process. And then there's this really positive thing called global deterioration scale. How positive is that, right? And so it focuses on numbers, and from 1 to 7 and that. And then there's the Aelc cognitive scales that Tipa talked a little bit more about because she's occupational therapist by trade, if you will. And that's where she kind of built then the gems, but still the Aelc cognitive scale is still a number system. The global deterioration scale goes 7 to 1 and 1 to 7, and the Aelc cognitive scales go in the opposite direction, 1 to 7. And one of the things that Tipa finds, and I find as well, once you start putting numbers on people, then we get focused on what number am I? And either if you're looking at 1, everybody wants to be 1, right? And no one wants to be a 7. Or I want 7 of something, but I don't want 1 of something, you know, and so we get into that. With Teepa's gems and as I work using that model and when to help me identify where this person is in their progression or where they're at in this moment, I find it's a lot easier for me than I'm focused on what characteristics do they still have and how can I help support that person rather than looking at it in that negative framework. It's a little bit more positive, if you will. And so we'll take just a few minutes today and kind of explore then those gems that Teepa's identified. And one more time, it's the sapphire, which is kind of also known as true blue, a diamond, emerald, amber, ruby, and then pearl. And that's going down in the cognitive sense from true blue, sapphires, no cognitive decline, and then the pearl being at those last stages. And we'll explore a little bit about those characteristics and kind of why Teepa kind of came up with the gems for the stages that she identified. We'll start with the sapphire. Like I said, it kind of is true blue. A sapphire is just that brilliant blue color, if you will. I'm a blue person, so I'm on there, right? Again, what some of the characteristics are typically, this is a person that at this point in time, no dementia is there. We may have normal aging as we go along because there are some things that as I age, my brain changes and we consider that normal aging, if you will. I'm flexible in thinking. So, you know, I come across life's challenges and I have that ability cognitively to kind of work through those things, right? And I have the ability to meet the changing needs of others. When I see others in having maybe some challenging situations, I have the ability to flex myself, if you will, and kind of meet them where they're at, but then come back and be in my normal state, if you will. Okay. We're gonna pause for just a moment, and although you guys aren't sitting, you're still pretty close together. We can kind of chat just a little bit about your thoughts about you being in this sapphire state and kind of how you think that impacts you when you're working and maybe dealing with others, if you will. So we'll pause just for a couple of minutes and let you kind of chat about that.
Do you have any pauses?
No. So you just think again about what abilities you have when you're in that true blue state, that sapphire state. Are there days or times where cues are helpful to you as you're going along? And then kind of what challenges come about during your day or where you're at in your environment, your work environment, if you want. So it's different for you guys. So I'll give you a couple minutes just to kind of talk about it.
I know when I'm at work, just seeing some of the patients, I know it's more medicine than actual dementia, but hearing some of the patients there and me still being able to talk and realize it. But like yesterday, I went and saw a patient and I said, okay, 2 more deep breaths and your treatment will be done. And he's like, didn't do anything. I'm like, just 2 more big deep breaths. I'm like, are you sleeping? What's going on? Did you fall asleep through this treatment? And he's like, oh, I'm sorry, I didn't know what language you were talking or what you were talking about. I had to remember where I was at. And then I'm like, oh, okay. And it's just the medicines that are trying to get out of his system for that, but just to try to do that part of it.
So, you know, challenges that you see when you're dealing with people.
Sure. I mean, there's some folks that, most of my folks are all more of a true blue than anything, but I do have a couple that fall under one of the others. And with all of the information we have and what you shared in the past, it's really helped me to be on the lookout and to notice that there's something wrong. And I do appreciate that.
Okay, cool. And then up, she talks about this diamond. And what kinds of things come up, do you think of when you think of a diamond?
Sharp.
Sharp?
No flaws.
No flaws?
Clear, just you see through it.
Yeah. And so when we have somebody that might be in this diamond gem and that, then yeah, we're looking at some people that seem to be maybe sharp on the edges. They're clear. And you think of a diamond being really rigid, right? I mean, they use diamonds for, cutting and different things, right? So they can be really rigid. They have many facets to them. When you start looking at a diamond, you can just kind of get all kinds of different angles and things, right? Yeah. And then these people, sometimes we can think of them as being cutting, that sharp edges. You think of them being just sharp in their tongue at times, saying what comes to mind, and it's there, right?
And no filter.
Yeah, sometimes. But this still can be pretty social, right? A lot of times, when we're talking with somebody more in the dementia frame, they become a little more focused on finances. And, how much is that? In my work environment, when I work on the unit, recently we had a patient, and we have the meal ticket that lists what they're supposed to have on their tray. And she was worried about that being like her bill. And how much is this costing me? There's not a cost. How much is this costing me? It's not here. Yeah. And so we kind of got to the point where we would take the food ticket, the meal ticket off the tray before it went to her, so that she wouldn't get fixated on the cost and paying for her meal and that type of a thing. There's also a respect for authority. A lot of times with somebody that's in this diamond gem, it could be that I'm the authority, I'm the person that knows what's going on here, you're not tricking me, I know exactly what's going on here. Or there's other situations where you're not the person, you're not in charge, I want your boss, I want them on the phone and I want to talk to them now. Don't just shake your head yes, get that person on the phone now. You don't know nothing, right? And so I'd ask you to kind of think about ourselves. I'll include myself in that. Are there times where, yes, for as far as I know today, I'm in that sapphire gem mostly. But if I'm under pressure, are there times where I could be more diamond-like? And Dan doesn't get to say anything about that. Are there times where, yeah, no, absolutely not, right? Yeah, if I'm honest, yeah, there are those times where if there's pressure, if I feel stress, then there are some changes in my cycle in my brain that come into play, and I'm still going to have those tendencies to get really tunnel vision and rigid and those types of things, right? Mm-hmm. And so I'm gonna pause again for just a moment and let you kind of talk about the diamond state, and things you may think about, times, situations that you may have had recently that you might, maybe I was a little more diamond-like in those situations. And then kind of compare and contrast, if you would, that sapphire and the diamond, the differences between those two, and what abilities when I'm working with somebody, it might be in this diamond gem. I'm running into a respiratory patient that's more rigid and inflexible, or you're running into a person who's upset and stressed. You don't ever have that, I'm sure. Ever. And your sapphire state, are there things with knowing those two things that you might be able to apply that might help you through some of those situations? So again, I'll give you a couple moments to kind of think about that and then discuss it a little bit.
As you were talking to me just a minute ago, I went, oh, that's probably what the problem is. We're having a really difficult time with one of the residents. And a lot of what you were saying is exactly what she keeps saying to us. And so I was like, I wonder. And we know she's got some other things going on, but she moved from Hawaii here to be at Vanderbilt for treatments. I don't know anything about what it is, but she's very unflexible. She will not let us in her apartment to fix things, even after we make appointments. So, we're struggling with her. Yeah.
I mean, just to try to put it into that perspective instead of, oh, well, this may just be how they are. Well, maybe to turn it into, for me to talk to them differently just because of this, it's good information.
Mm-hmm. Yeah. Okay. All right. So yeah, so we can hopefully, and as we continue to explore the other gems that are there, you can continue to think about your situations and what you're come up against, and begin to put together then, knowing my abilities and where I'm at, and then maybe looking at that in a different light as to this person's reaction. How might I be able to shift, if you will, and maybe have a different outcome from what we currently have? All right.